My name is Dr. Tolu, and today on my YouTube channel, I'm going to be talking to you about 5 common reasons why people slump and die. Right, so if you like what I have to say, please hit the like button, hit the subscribe button, and if you have maybe a question for me or you want me to discuss something sometime in the future, also leave a comment for me as well. Or if you just want to say anything that comes to your mind, leave a comment for me as well. So guys, without much ado, let's get right to it. So guys, the 5 main causes of sudden death are pulmonary embolism, cardiac arrest, heart attack, aortic rupture, and also intracranial complications, chief of which is a stroke. And I'm going to be discussing them one by one. The first I'm going to be discussing is what we call a pulmonary embolism. Now, a pulmonary embolism happens when a structure, usually a blood clot, travels all the way to a blood vessel in the lungs and then blocks it. So just think of the body, or think of your lungs, or any parts, any organ in your body. It has vessels that carry blood to it, the blood carrying oxygen to it, and then it also has vessels that take blood away. So you have arteries, which are the ones that take blood to the organ, and then you have veins, which are usually the ones that take blood away. Right now, a pulmonary embolism, the blood clot that usually travels, right, is usually from a deep vein in the legs. And when that happens, so usually, let's say from the legs, it travels all the way, and then it blocks a blood vessel in the lungs, and then that causes the pulmonary embolism. So pulmonary embolism is something that it should be treated as a medical emergency, and it's also a common complication, especially when it concerns major surgeries, right? It's something that we tend to see in those kinds of cases. But then it doesn't only happen when someone has had surgery. It can also happen maybe if someone has not been very mobile for a while, and then the person now starts moving, and then the clot will just be dislodged and then cause a pulmonary embolism. The common symptoms that someone who is experiencing it will tell you is that they may be experiencing chest pain or chest tightness. Those are some of the common symptoms. And for a pulmonary embolism, prompt treatment is very, very important because it can be life-threatening. I mean, we are talking about causes of sudden death, and if this is one of the causes, so you know that when it happens, it can be life-threatening. And prompt treatment can help to save that life and reduce the risk of sudden death. Second thing on my list I'll be discussing now is what we call a myocardial infarction, or what is commonly known as a heart attack. Now, remember when I talked about pulmonary embolism, I talked about a blood clot blocking an artery in the lungs. A myocardial infarction also usually involves a blockage, right? Similar to that happens in a pulmonary embolism, but this time around it's not happening in the lungs, it's happening in the heart muscle. So imagine a blood clot, right, blocking a blood vessel, and so that part of the heart cannot get good blood supply, and that's what happens in a heart attack or a myocardial infarction. Now, this is also life-threatening, and this is something that can lead to sudden death, especially if the right steps are not taken. Now, in a myocardial infarction, when it happens, the person that it happens to is most likely still going to remain conscious, but the person will start experiencing maybe like chest tightness or pain. And then some of them don't experience this on the shoulder. Some of them, or some people who experience it, may experience it not just in the chest, but also around that region, right? And even in women, especially in women, many of them, when they're experiencing a heart attack, they tell you that what they may have experienced may not have been chest pain, but it may have been tummy pain, right? Or upper abdominal pain. So many times, some women go to the hospital and may be saying that, okay, I'm experiencing pain in my upper belly, right? And then when I will do maybe an ECG or we check their heart, then we find out that, oh, they are actually having a heart attack, right? So this is something that we need to pay careful attention to, because the earlier we can catch it, then the better the chances of survival in the person. Now, number 3 on my list, I'm going to just talk about intracranial complications, but I'm going to focus more on what we call a stroke, right? Or what medically we also call a cerebrovascular accident. Now, what happens in a stroke is also has to do with blockage of blood supply. But this time it's not blockage of blood supply to the lungs like in pulmonary embolism, neither is it blockage of blood supply to the heart muscles like in a heart attack. But in this case, it is blockage of blood supply to the brain. Now, the reason why when there is blockage of blood supply to an organ, why that can have drastic consequences is because blood carries oxygen, right? Carries oxygen to these areas. And oxygen is one of the things that helps living organisms continue to live. In fact, it's the reason why you are alive, right? Because of oxygen. So when there is a blockage of blood supply to a part of the brain, that's what leads to a stroke. Now, a stroke is also life-threatening. A stroke commonly causes sudden death, and that's why we need to pay particular attention. When a stroke happens, it is life-threatening and it requires prompt medical treatment. Now, when someone has had a stroke, one of the most important things we can do for that person is to get the person to a hospital, right? Because there are some types of medication that can be given to those who have had a stroke that can minimize the brain damage due to the stroke. Other things we look for, that we look to do for people who have had a stroke is also to get brain imaging done, minimizing the damage to the brain, and then also taking steps to ensure that the person is able to, because when someone has a stroke, it usually leads to symptoms like maybe the person may not be able to talk as they used to talk, or may lead to other problems, even with mobility and movement. So part of the treatment is to help them to get into the shape that is closest to how they were before the stroke, and also taking steps to reduce the risk of a stroke happening again. And that brings me to the 4th thing on my list, and this has to do with the heart, right? But it's not a heart attack, it's a cardiac arrest. Many people don't really know the difference between a cardiac arrest and a heart attack, and it's one of the things I'm going to be discussing now. So I've already talked about the heart attack, right? A heart attack happens when there's a blockage of blood supply to the heart, and because the heart muscle is not getting the blood that it absolutely needs, then it causes symptoms like maybe chest pain, which travels to the shoulder, or in women, you may have some level of chest tightness or even discomfort in their upper abdomen, all sorts of things. But I've explained that when someone has a heart attack, chances that the person is still conscious, chances that the person may still even be able to say a couple of words. But when it comes to a cardiac arrest, there is a problem or an interruption of the electrical activity of the heart. And when that happens, the heart stops. Now, one thing that we need to know about the heart is that it has electrical activity. And some of these things are the things that work hand in hand to ensure that the heart is beating normally. But when something happens to interrupt the electrical activity of the heart, then that can lead to an arrest of the heart. So when someone has a cardiac arrest, it has more to do with an interruption of the electrical activity of the heart. And when that happens, unlike in a heart attack where the person may be conscious, where you can still even give the person aspirin to chill, that kind of thing, in a cardiac arrest, the person is unresponsive, the person stops breathing, the person is unconscious in a cardiac arrest. So a cardiac arrest is a very dangerous thing. And what that person needs at that point in time, someone who has a cardiac arrest, is that first of all, we need to make a call to the emergency services, whatever emergency number it is in your country, whether it's 911 or whatever it is, right? And then CPR has to be commenced on the person as soon as possible. Now with CPR, what we even need to do are chest compressions and then giving breath to the person, right? And this needs to be done continually, because CPR being done at the right time in the right way improves considerably improves the chances of survival in someone who has had a cardiac arrest. If maybe you have access to a defibrillator, those things in movies that have these pads that they rub and they put and then they shock the person. What they're trying to do is to restore electrical activity to the heart. So if there's access to a defibrillator and there's someone who is still using it, then that can also help to make the difference between life and death in this person. So that's the difference between a heart attack and a cardiac arrest. Both are life-threatening, but both are quite different. And number 5 on my list is what we call aortic rupture. Now, this just sounds like it's like a big name for something that happens. It's deadly, but it is not complex, right? So what happens in an aortic rupture is there is something called the aorta, right? It's a blood vessel. It's the largest blood vessel in the human body. Just imagine that you have a dam that controls water, right? And then something breaks the dam. You know how forceful the water will push out of the dam? That's kind of like what happens in the aorta if something affects the integrity of the aorta and now causes a dissection or a tear in the aorta. There are some things that increase the risk of one having an aortic rupture, and one of those things is high blood pressure. Being able to manage your blood pressure considerably reduces your risk of having an aortic rupture. Like I said, an aortic rupture is something that can kill in a matter of minutes. Another thing that can lead to an aortic rupture is anything that causes trauma and that maybe punctures the aorta or pushes it and damages it, and that now leads to the rupture in the aorta. So those are two common things that predispose to an aortic rupture. So it's very important if you have anything regarding high blood pressure to do what you can, maybe with medication and lifestyle changes, or even a combination of different treatment modalities so that your blood pressure is under control and the risk of having an aortic rupture is considerably less. Alright guys, so thank you for listening to all I had to say. If you found what I had to say useful, please hit the like button, hit the subscribe button, and share this video or the link to this video with your friends, families, especially those that you think will find the information beneficial. Right, and also if you have a question for me or if you just have anything you'd like to tell me, leave a comment for me as well. Alright guys, so thank you for listening. Bye.